This is a Jet 24, Funk 66, your Erie.com special report.
Good afternoon. We interrupt our regular programming this afternoon to bring you a special report, Erie County's final weekly briefing on the spread of and fight against COVID-19 in Erie County. This coming as the number of cases declines and the percentage of vaccinated people goes up. We want to go live now to the studios of WQLN Television. Here's Erie County Executive Kathy Dahlkemper.
Good afternoon, and thank you for joining us for our final regularly scheduled COVID-19 press conference. Thank you for tuning in to stay informed over these past almost 15 months and for doing what you have done and continue to do to help slow the spread of the virus in Erie County. We will continue to update the public on social media and at eriecountypa.gov. And if we have any significant announcements, we will hold additional press conferences. It's important to understand, though, that while we are discontinuing the regular press conferences, we are still fighting this virus in Erie County. It's still very present here in our community and always looking for its next host. Our positivity rate and hospitalizations have been steady and higher than we had hoped to see at this point in the pandemic, which, as I stated last week, is a bit concerning, knowing that all adults can get vaccinated and it's also free. COVID-19 is now considered a preventable disease. From the moment that this virus came into existence, directions have shifted and new protocols have been set as we all gained better information. Months ago, this disease was not preventable, but today, due to the miracle of science and the dedication of so many across this globe, we have the ability for almost all of us to get vaccinated, making it preventable. So please take advantage of the availability of the vaccine to keep you, your families, your loved ones, your friends safe and healthy. What we know for sure is that we have the tools at our disposal that do work in stopping the spread of the virus and keeping our community safe. We know that social distancing, good hand hygiene, and masking work. We also know that vaccines work. And being fully vaccinated means that you can participate in many more activities, and most often, you don't need to wear your mask. Today, we have 18 positive cases to report of COVID-19, and unfortunately, again, one additional death. We've had at least 21 hospitalizations and 2 people on ventilators within our local hospitals here in Erie County. Since last Wednesday's press conference, we've had 136 additional cases with 1 new death. I do have one last request, that if you are feeling symptomatic, please get tested right away. It's so important for you to find out if you have COVID or not. Your efforts when it comes to testing will help reduce the spread of virus throughout this community. To tell us more about the importance of testing, vaccinating, and following the known mitigation protocols, I now want to invite Shar Behringer from the Erie County Department of Health to join us once again today. Shar?
Thank you very much, County Executive. While the recent decrease over the last week in reported COVID-19 cases in Erie County appears to be encouraging, the Erie County Health Department strongly recommends that the entire community continue to use proven methods to keep our county safe from COVID-19. Even with the decrease in numbers, as has been stated, our hospital rate has remained basically steady for COVID, and the test positivity and use of ventilators has also remained pretty steady. Erie County has a higher incidence rate and test positivity than the state overall. It remains important to get tested, even if you only have mild symptoms, even if it's something like a headache, sore throat, a stuffy nose, more stuffy than usual if you have allergies. It's important to get tested because even people with these mild symptoms can pass the coronavirus on to unvaccinated family and friends who are less healthy or more likely to become sick with COVID-19. If you do test positive, it's important to isolate a minimum of 10 days This will keep the virus from spreading to others while you heal. For close contacts of persons with COVID disease, quarantining is still very important if you have not been vaccinated. This is important to avoid inadvertently infecting your friends and family and loved ones if you acquire the disease related to being a close contact. For those who are fully vaccinated and have had close contact, testing is only needed if you develop COVID symptoms during the 10 days after the close contact occurred. The definition of a close contact hasn't changed. It remains that someone who's within 6 feet or 6 feet for 15 minutes or more in a 24-hour period with someone with COVID disease. The really wonderful news is that the huge majority of us now have the power to prevent this disease. The COVID vaccines are proving to be safe and effective. They're readily available and free of charge for everyone. Some people are concerned about side effects from the vaccinations. It's normal to get side effects from vaccinations. With COVID, the benefits of being protected from this disease are not only be protected from disease, but not be concerned about infecting others, and the ability to safely go without masks indoors and outdoors far outweighs the inconvenience of 1 or 2 days of side effects. Our community's public health relies on all of us doing our shared part to help protect each other. Let's have a really good summer. Thank you.
Thank you, Shar. And we understand there's lots of questions out there about the loosening of the mitigation efforts, and we want to help provide some clarification today. So I'm really grateful that Amy Machinsky, Supervisor of Environmental Health Services at the Erie County Department of Health, is able to join us. And now I'd like to turn it over to Amy.
Thank you, County Executive. Yes, as you stated earlier, we know what works and what has been working for us throughout this pandemic. And although the mitigation orders are loosening to where if you are fully vaccinated, you do not have to wear masks, we are still recommending that masks are utilized. As said earlier, we know that this works. We know that this helps slow the spread of the COVID-19 virus. The virus is very much still here. It is not gone. It has not gone away. So we need to just make sure that we are doing due diligence and being vigilant of the things that are around us. And using masks has proven itself useful and has worked. So though the mitigation orders are lifting to where if you're fully vaccinated, you do not have to wear masks, remember those that are not vaccinated and under the age of 12 are still required to wear masks. So those things have not changed for them.
Well, thank you, Amy. I also want to provide a bit of an update on the Emergency Rental Assistance Program that's being run through Erie County Care Management. This has been such a great help for those who've really struggled through this pandemic, particularly with their housing issues. We've had over 1,300 applicants submit to this program. More than 400 households have been approved so far, with payments, and 200 more are currently in process. More than $2.4 million has been approved out of the funding that we have received, and we have already checks been sent out, payment made for $1,369,000 already out the door, with, as I said, $2.4 million promised, so that money going out shortly. So this program is available to those who are in need, and I ask you to either go on the Erie County Care Management website or on the front page of eriecountypa.gov, and you will find the link to find out if you are eligible, if you are struggling to pay those rental bills that you have or some of your utilities. And now I'd like to turn it over to the media, and we will start today with Erie News Now.
Hi, good afternoon. A question for Shar. As we hit the 2-week mark after the mask mandate for vaccinated people was lifted, although we know, of course, that there are obviously unvaccinated people out there who are not wearing masks as well, any concern that we might soon see a rise in cases because of that?
Shar, you're muted.
I'm sorry. Ethan, in response to that, we in public health will not be at all surprised if we see an increase in cases. It's really, really important for those persons who are not vaccinated to continue to wear their masks.
Thanks. Also, Kathy, it's a little hard to hear both of the guests. I don't know if there's anything that can be done on that end, but you're loud and clear, and they're a little tough to hear.
Hopefully our technicians here at WQLN can maybe adjust that. Thank you for letting me know. We'll turn to Jet TV.
Hi, Kathy. I know this is no time for looking back because we are not out of the fight yet, and I clearly understand that. However, being that this is your last regularly scheduled press conference, it makes me want to ask, as you look back over this, we all kind of started out flying by the seat of our pants and trying to get a feel for it. What are your reactions? Is there anything that you thought, boy, we could have done something a little better here, we could have integrated business a little better or something, or is there something that, that I'm proud of, that I feel, boy, we did really well, we got on this early and we helped people get to this point? And I clearly understand we're not out of the woods yet, but I'm just talking about to this point. Is there anything along those lines that strike you as being either extraordinarily good or extraordinarily bad?
I think that one thing that, well, certainly we've talked about this many times. We have a health department in Erie County, which was a huge advantage for us. There's only 6 counties in the entire Commonwealth and then 4 municipalities who have their own freestanding health department. So that put us at a great advantage. But I want to say I was so impressed with the environmental team, and we have Amy on with us today, but what they were able to do in terms of building partnerships with our businesses, with our school districts, with those entities who really didn't know what to do in the wake of sometimes confusing and conflicting information coming out of the state or the feds. That team was able to be such a great partner to the community as a whole. Phenomenal work, really. Our we have 13 school districts, and those superintendents, I think every one of them would probably say that they really leaned in and leaned on the health department for guidance when they often weren't getting it from Pennsylvania Department of Education or others, and they could always turn to that group coming out of our environmental division. So I really want to give kudos to that entire team, of course the whole health department. And I will say, I truly believe, because we have a health department, a very capable, skilled group of people working at the health department, and because of the community coming together collaboratively, many lives were saved in Erie County. We took early action. I think that was the right thing to do, and for that, because of that, we'll never know how many, but I truly believe that we saved lives here in Erie County. Thanks.
Thanks.
All right, we'll go now to Erie Times News, to David.
Yes, Kathy, thank you. As we get closer and closer to the Memorial Day relaxation of almost all the mitigation measures, if you can, Kathy, tell me a little bit more about what business folks have said to you, the ones you've come in contact with. Are they prepared? What do they expect to see come Monday and the days right after that?
If you don't mind, I'd like to turn this to Amy, because they are the ones, she and her team are the ones talking to those businesses on a regular basis. Amy?
Thank you. Yes, we have been providing a lot of information and education resources to businesses. We truly do believe that businesses are ready for this, and they do understand what the risk is to their employees as well as to the public. So we believe businesses are ready, and we believe that the community is ready and can do so safely as well, keeping in mind that, everybody is still understanding that COVID-19 has not gone away, and it is still here, and it still can be transmitted, and it still can be passed on. So we made it very clear to a lot of business establishments and a lot of events that are coming up and what the risks are, and we really try to be a valuable resource to the community in helping making these events and businesses thrive. Thank you.
Thank you, Amy. And a quick follow-up to you or whoever wants to answer this. Talking with some business owners, they're real worried about the unvaccinated people coming in unmasked, and they don't want to be the mask police or the vaccine police and ask their customers. What do you say to those people who are not vaccinated who plan on showing up at businesses and not wear a mask?
Well, we hope that that they understand the risk that they are putting not only themselves but others. Think about the workers of the establishments that are trying to get their businesses back up and running and back into good standings. The risk that they're putting those people at, and the under immunized people, is really great. So we're really hoping that the masking, still does continue, even though it does loosen, because there is still, this public health that we, are striving for to build our community and be able to loosen things altogether. And once we get to that point, again, remember, we're only at 40% vaccinated. So there's still a lot of risk out there that can be transmitted, to loved ones.
Thank you.
We'll go to Joel at Talk Erie.
Thank you, County Executive. Another question, maybe to follow up on David's question for Amy. Are there any particular new guidelines coming out about conducting business after the 31st? I mean things like the plexiglass and, social distancing. Is all that out the window now for businesses that are reopening?
As of right now, after the 31st, the only requirement, and the key word here is requirement, is that masking still applies to unvaccinated people and children under the age of 12. All the other mitigation requirements have now become recommendations. So hopefully that answers your question.
Okay, and just a quick follow-up on your answer to David. Insofar as that those that are vaccinated, they really don't have anything to worry about if they enter a business and there is an unvaccinated, unmasked person, correct? It's really the contagion is between unvaccinated people.
I'm actually going to pass that over to Shar for a clinical response, because that's a little out of my wheelhouse. Thank you.
Thank you. Thank you.
You are correct, Joel, that vaccinated persons are not considered able to transmit vaccine. The risk for vaccinated persons, there's a very, very, very small percentage of vaccinated persons who do get what's called breakthrough disease. In other words, they do get COVID despite being vaccinated. But we know that is a really small rate. That answer your question?
Yes, thank you very much, Shar.
Thank you. We'll go back to Erie News now, to Ethan.
Hi, another question for Shar. We've talked about, or we've heard the county talk about it, as well as hospital leaders talk about needing to shift approaches away from big clinics to more community-based outreach. Any plans to continue that process? What can we expect kind of down the line here as the vaccination effort continues but changes gears a little bit?
You are correct that the vaccination efforts are ending as far as the very large mass clinics. The need for them has been met. So our vaccine team is very definitely looking at smaller, more focused vaccine opportunities in our county.
Any clue when we might start seeing some of those throughout the county, when we could see, a lot of those going down, smaller clinics or clinics at businesses or at schools or anything like that? I know we've seen some, but when might we see a more widespread vision of those?
At this point, will really depend on demand. Has plans to get at least several of these, so we'll really have to what the show rate is like that are offered.
Thanks.
So this, I think, is a great segue for me to just make an announcement that the Church of the Covenant asked me to make. That's the First Presbyterian Church of the Covenant at 250 West 7th Street. They're going to have a clinic a week from Sunday, which is June 6th from 3 to 6 p.m., and they're going to offer free Porky's Pizza to all vaccine recipients during that event. So I think we're going to see more events like this, which kind of goes to your question, Ethan. They will be, I believe they're working with UPMC for that vaccination clinic, and those are the kind of targeted clinics that we will see many more of. And now we'll go to Jet TV to Scott.
Kathy, I was wondering about the kind of marketing approach as this effort goes on to try to convince more and more people, and as you get past some of the mass things, then you're left with folks that have their individual reasons why, for whatever reason, they decide not to go after that vaccine. From somebody whose kind of job it is to try to get as many people vaccinated as possible, what's the change in approach then? How do you change the message or change how it's delivered or figure out a way to try to talk some of the folks who are the most reluctant to get on board?
It's really difficult, as we all know, because we've been trying to do this, but some of it we believe is truly making it just much more convenient for people, like showing up at a Seawolves game. UPMC is doing a clinic at the Seawolves, by showing up at your church, or by showing up for the clinics to show up in your community. You know, if you live in one of the more outlying areas from the urban center, it's not as convenient for you, and your work schedule may be making it more difficult. Also, vaccine into our trusted pharmacies, which most of them have the ability to vaccinate now. But much of this messaging, as we know, is being done on a national and a state level, and I think it goes to the specific groups of people and what will make them change their mind. And unfortunately for some people, and I anecdotally know of some people, it has taken someone getting very, very ill and being hospitalized for them now to say, yeah, we're going to go get a vaccine. And I hope it doesn't get to that for most people, but that's the truth of the matter. Those are the people most at risk right now, are the unvaccinated, and they are the ones who would get concerned about will end up in the hospital. But that messaging, I think, has to continue to be very targeted, but I think one of the biggest things that we can do as a health department and county government is to try to make sure that the vaccine gets to places where people actually live, work, play, worship, and then we hope we can see some numbers going up.
Thank you.
David, Erie Times News.
Sure, Kathy. And sticking with the questions about Monday and going and relaxing most of the mitigation efforts, what do you think is going to be the economic impact locally on businesses, restaurants, taverns, places that hold events? Do you think we're going to see a dramatic boost in their profits, or do you think it's going to be very gradual?
I mean, I don't know if it'll be dramatic. I think it's already started. Of course, we're moving into summertime, which is our best time of the year for many people, where they're out and about and doing lots of things socially and spending money in our community. So I do think that we will see a much better summer financially for businesses than we saw last summer, of course. But I do think it'll be gradual, because I do believe there are many people who are vaccinated who are still hesitant to get out and about. And I think you're still going to see a lot of people wearing masks in places like stores who are vaccinated, also along with hopefully the unvaccinated. And so I think that they will, as people are becoming vaccinated, I do see people feeling more comfortable. I talk to people. I myself am more comfortable, going back to doing some of the things I did before, and I think that's true for most of us as we get vaccinated. And for the unvaccinated, many of them felt comfortable before, and they're just kind of falling back into their normal patterns. So I do believe it will happen. I just don't think it's going to be a dramatic shift, except that we know summertime will bring the people out, no matter what year it is, in greater numbers.
And what role do you think the hiring issues that so many businesses in the service industry especially, but in other industries as well, the hiring problems they're facing, how much do you think that will play in a role in not earning much bigger revenue quickly?
Well, certainly the workforce issues are huge, and it's something every business I know of has been contending with, and some are reducing the business that they do, whether it's reducing their hours or even reducing the number of customers they can service, and people are going to find that they have longer waits for maybe some of the things they want to do, or they can't get into a restaurant because it's not open anymore for lunch, for example, because they just can't find the people to be there for breakfast, lunch, and dinner. And that's, I think, what we're going to see happening. Even in the social service arena, we were just talking about this today with my Department of Human Services, that they also, all of our providers are experiencing this issue with a shortage of people to come and do the work that needs to be done for those seeking help. And so if you need an appointment for any kind of a mental health issue or a number of things that could be going on in your life, you may have a much longer wait than we would want you to have. And so it's something that has got to be addressed and figured out. No one really knows the true solution, but I think as more people figure out their barriers to them getting back to work and how to get around those, hopefully we can get some of those people back to work.
Thank you.
Sure. Talk Erie, Joel?
Yes, thank you, County Executive. Another question for Shar. Shar, you were mentioning how important the testing was, and I'm wondering if you're encouraging different workflow now. With many folks, when they got sick during the peak of the pandemic, they just went to a pharmacy to get a test themselves or what have you, and maybe their primary care found out about it on the back end if they had a positive case. Is the workflow now that you should go see primary care if you get ill with a respiratory disease?
No, it's actually still very much with the pharmacies. The hospitals are also testing at each of their facilities, and we as a health department are doing some mobile testing also. So in a private physician's office, it's unlikely that they are going to be willing to test for COVID or that they'll have the appropriate supplies to test for COVID. Pharmacy contracts are still in place. The health department's offering testing. The hospitals are offering testing. Still the best bet.
So, yeah, if you're feeling sick and you could suspect that it's COVID, it's still the same process versus any other disease that you would just go see your doctor.
Yes, it is.
Thank you.
And I would just like to again say eriecountypa.gov. You can go on there. You can find those testing sites. You can find the contact numbers to those places. You can find out what our mobile testing unit schedule is and where they're going to be, if they're going to be in your neighborhood. So please take advantage of that resource. And we'll go back for a final question from Erie News Now. Ethan.
During any of these news conferences, so I suppose it needs to be for you, County Executive. Are you on board with the state's idea of doing away with the extended unemployment benefits for people who aren't actively looking for work come July? And do you think that that will help address the work shortages that we're seeing here in Erie County?
I think that the extended unemployment is a portion of that issue. I also believe that people are really struggling. Some people seriously are just very cautious and nervous about going back into the workplace and feeling safe knowing that there's probably unvaccinated people who will be at the workplace with them. I think others are struggling with child care issues. We continue to struggle with, what do you do with your children, because some schools have to have short closures, and so their children all of a sudden are home, and who's to take care of them if mom or dad can't be home. So I think there's a myriad of issues, and it is true that some people are actually making more money on unemployment, which to me is just shows, I guess, how we really aren't paying some people a living wage, and so it's hard for them to even be able to pay their bills on what they have made in the past and what they would go back to if they didn't have that extended unemployment. So I think we really need to look systemically at this situation and as a country, as a state, and as a community, decide how we can assist those people, whether it's some of those barriers I talked about or whether it's the financial piece that keeps them out of work.
Thanks.
Thank you. And Jet TV, Scott, do you have a final question?
No, County Executive, I think I'll pass. I appreciate your answers to this point.
And we'll go back to David, Erie Times News. I think you've been with us almost the whole way along, almost every time. David, do you have a final question?
Yep, except for vacation weeks. I've been here all along. So I want to ask you kind of a reflective question on this, Kathy. It's been 15 months. It's been a lot of surprises. What has surprised you and the staff at the health department the most about this coronavirus?
Well, first of all, that we had to deal with it. Let's just start at the beginning. None of us expected this. It was a shock to the world. It was a shock to us. I think the complexity of this pandemic, there were so many twists and turns almost on a weekly basis, the things that would come up that was really outside of what you would think would happen. You could not really truly plan for this pandemic. You can do those tabletop exercises, but something of this nature and this widespread and this complex is something none of us could have truly been prepared for. But I think the other thing that has surprised me in a very pleasant way and a very heartwarming way is this community as a whole. I mean, here we are doing work at QLN. They've made this available to us how many weeks now? All of the media has been so supportive in getting the message out. Our hospital systems, which we know are not always partnering in everything they do, really came together and partnered through this. Our neighborhood centers partnering with our health systems to really get to some of the populations who are most at risk during this time. And I mean, just on and on. This community truly gelled together, found a way to collaborate and to save lives collectively, and I can't say enough about the beauty I've seen in that. This is really a special place to live, and a lot of very special people in this community.
And one quick follow-up, how does this pandemic change public health long term?
My hope is that we understand that we have got to invest in public health, because public health is absolutely essential to the quality of life of a community and to the economic success of a community. So if there's any doubt about that, and just look at what happened over this past year, public health has to be integral to our community, and it has to be invested in as beyond this pandemic and going into the future.
Thank you, Kathy.
And Joel, I believe you've been with us every single week. I don't know if you've taken a vacation, so you're going to have the final question today.
Thank you so much, County Executive. And it is for you, and again, in that reflective nature, there's a lot of talk about the long tail of COVID, that after the pandemic, what are the after effects? So in the aftermath of the COVID pandemic, what do you think that the community should be focusing on in the long term? Is it children's educational outcomes? Is it behavioral health and some of the issues we're finding there? The financial recovery of our small businesses? Or does something else keep you up at night?
So we have a great opportunity, I think, with the American Rescue Plan funds that we have coming into this community to look at how we can make some transformational changes in our community. We should not be using this money to, fix as the proverbial pothole, right? We should actually look at the trajectory. And there's a lot of great ideas out there, and we've got to sift through those and determine what is actually possible going forward. But I do believe there's so much that we have learned through this pandemic, and that we need to take those lessons. So the things that keep me up at night are, I think, all the things that were unveiled. There was a lot of stuff that was unveiled through the pandemic. You talk about the behavioral health issues. We were having mental health and behavioral health issues within our younger people that has been growing for years, and this pandemic has just exacerbated that. So what can we do differently to try to change that trajectory going forward? The racism and the systemic racism that resulted in communities of color being adversely affected by this virus in much greater numbers. But we knew that there was already health inequities in those communities, and this has truly taken the curtain away, and it exposed that for what it truly is. And those are the kind of things that I think we need to really be looking at. And then when it comes to our businesses, I'm going to go back to the fact that before this pandemic happened, Melissa Lyon was kind of trying to beat the drum that public health was absolutely essential to economic development, and was listened to but not really taken seriously. And now I think everyone's taken this very seriously. So our private businesses have to understand how important public health is, and I think they do now, and we know we all have to invest in this for the well-being of our future, and that helps businesses to be more resilient when you have healthier population and who can actually come to work every day and help sustain your business. So lots of work to be done, but I think we've all learned a lot, and hopefully we'll take those lessons forward and do good things.
Thank you, Kathy. Appreciate it.
Thank you. Well, I want to end with some thank yous myself. I want to first of all thank all the viewers and listeners who've stayed with us for this past year plus. I want to thank the media. Again, you've been so diligent in getting the information out to the citizens of this community in a way that is, accessible to them, and I just want to thank you for being with us this whole way along. And again, this pandemic's not over, but for this particular time frame, you have certainly been with us all along the way. I want to thank the many, many guests who've joined me over these almost 15 months on this press conference, whether it's our hospital systems, whether it's the Erie County Department of Health staff, whether it's Dr. Nadworny and just so many other great people who were able to join us. You helped get out the latest and most accurate information from a local perspective, and that was so important. And again, I can't say enough about the staff at the Erie County Department of Health and the county employees in general who've been working so diligently on fighting this virus and this pandemic over a long, long period of time. I want to thank Mark Blakeney, who unfortunately couldn't be with us these last couple weeks, but we all know he was with us most of the time interpreting for those who have hearing challenges, so thank you to Mark. And finally, a huge thank you to WQLN, who is our public TV station, and they've certainly shown through in their public mission while they have allowed me to do these press conferences right here from their studios, allowing all the other media to have the kind of access that we wanted everyone to have, but in a very safe manner. So again, I appreciate everybody being with us. It is not over, so in the meantime, I ask all of you to continue to do what you can to keep this community safe. I ask you to continue to wear your masks, especially if you're with people you don't know and you don't know if they're vaccinated or not. Certainly, if you are not vaccinated, it is mandated that you continue to wear your mask, and I ask you to please do that to keep yourself safe, to keep your family safe, and to keep our community safe. I ask you to please use good personal hygiene with your hand washing and such. That will keep you safe from a lot of things going forward beyond COVID. And if you're feeling ill, stay home, get tested if you need to, and get vaccinated. Go to vaccine.gov, find out where you can get that vaccine. It is free. It's a federal resource that's available to every resident of this country. So I ask you to do all of those things and to stay safe, and to remember that the Erie County government, particularly the Erie County Department of Health, will continue to stay on this virus, will continue to fight it as long as it's with us. Thank you all for being with me for so many months. I've really been grateful to all of you. Thank you.
This has been a Jet 24 Fox 66 special report. For ongoing developments, log on to yourerie.com. We now return you to your regularly scheduled program.